Yes.
Right. Okay. Welcome to our 16th School Health Research Network webinar. If I could introduce myself, I'm Joan Roberts, Manager of the School Health Research Network. And this is the second webinar of the academic year. And I would like to say it's planned, but quite a fortuitous coincidence that our webinar on summer holiday experiences and mental well-being on return to school is being delivered within Children's Mental Health Week. So that's a good sort of link there. Our previous webinars are on our website for you to consider and to look at when you have a moment. And this will be added to that probably tomorrow. So just want to welcome everybody who's joined us. I think we're all on computers and laptops, but if some of you have had issues with IT and if you join us on phone, you can email shern@cardiff.ac.uk, and Gillian, my colleague, will send you the PowerPoint slides so you can follow as we talk. And we can see that as we're sort of looking down the list, we've got people from schools, healthy school practitioners as well. And so for those of you who haven't joined a webinar before, can I just point out a couple of things? So you'll see that there's a banner entitled chat. There's all sorts of different chats, but you can type any thought or query into that as it occurs to you, press enter, and then I can ask it on your behalf as the time seems appropriate through the presentation. So on to the main event. So we're very privileged to welcome Dr. Kelly Morgan to talk about this topic. She's done, so I'll just move it on to the slide. So she's done a third of a webinar before. She joined us a few years ago now to talk about physical activity and sedentary behaviour based on the Shern data from a few years back. But now she's going to return and talk about this topic. So welcome, Kelly.
Thank you very much. So hello everyone, and thank you very much for joining me and for giving me the opportunity to share our findings. So I'm going to be sharing results from our study, which used the Shern data to look at summer holiday experiences and how that's linked to young people's mental well-being on return to school. So essentially, I'll talk about why this research is important and what exactly we aim to find out. How do we go about running the study? What are our main findings? And probably most importantly, what the findings mean for you and your school. So to begin, kind of the background for the research, as I'm sure you're aware, childhood and adolescence are critical periods for development, for health, and for actually what happens in the longer term. So our health and our behaviours in adolescence, for example, are linked to our health later on in adulthood. So it's really critical that we are kind of nurturing health and behaviours during childhood. Previous research has shown that up to one in three children in each classroom can suffer from mental health problems. And linked to that, we know that families and young people from poorer families are more likely to experience poorer health and also perform less well at school. And then coupled with all of this, we were particularly focusing on the summer holiday periods. Now, this can be a particular crunch time for families. So if you think about children who are entitled to free school meals, there are now 6 weeks in the school year, just in the summer alone, where they no longer are provided with a free lunch. So parents are having to source that that extra meals for one child or perhaps multiple children in the household. On top of that, perhaps there's extra childcare costs in the summer holidays, and perhaps sourcing extra money to enable children to go out and enjoy activities in the 6-week period. So this does present quite a challenging time for some families. So to date, there was a gap in the research area of which we wanted to fill. And in particular, we wanted to look at our experiences during the summer holidays linked with students' mental well-being on return to school. And with that, we also wanted to have a look at, do findings differ between students from more or less affluent families? So how exactly did we go about answering the aims of our research? So this study used data from the 2017 Student Health and Wellbeing Survey. So there were approximately 193 schools who took part, and that enabled us to access data from, as you can see, nearly 102,000 students ages between 11 to 16 years. So as you know, the survey asked a wide variety of questions, and we particularly honed in on questions around the summer holiday. So we asked, during the summer holidays, how often do you exercise? Do you spend time with friends? How often do you go to bed feeling hungry? And also, how often do you feel lonely? And for each of these questions, children had response options of none of the time, rarely, some of the time, often, or all of the time. We also asked questions around mental well-being, and there were two particular questions which we asked. One is the Schwemmweb, as we call it. It's a short mental well-being scale, and essentially this comprises 7 questions, and within this we ask, for example, how often have you been feeling optimistic about the future? How often have you been feeling relaxed? So it's quite a positive scale, and that gives us an overall mental well-being score. And we also asked questions related to internalizing symptoms, and these are questions based on symptoms for both anxiety and depression. So, for example, how often do you feel low? How often do you feel irritable? How often do you feel nervous? And then both of these scales then were used to create both a mental well-being score and also an internalizing symptom score. So this one, yeah. As I mentioned, it was important for us also to consider family affluence as part of the aims of our research. So we have a 6-item question which gathers information around families, holiday times, the number of computers in a home, for example, and car ownership. And this is collated into a scale where we have young people in low, middle, and high affluent families. So what did we find? In terms of the broad overall picture and children's experiences during the summer holidays, we found that roughly 1 in 6 young people reported being frequently lonely. And with that was either often or all of the time. 1 in 6 never or rarely spent time with friends. Approximately 1 in 16 went to bed hungry, often or always. And more than 1 in 4 young people reported that they never or rarely exercised during the summer holiday period. For these experiences, what we observed was actually children from poorer families were at higher risk of experiencing negative summer holiday experiences. So, for example, 1 in 6 reported being frequently lonely. For this particular outcome, we noted that 1 in, bear with me 1 second, 1 in 5 in high affluent, 1 in 5 children from low affluent families experienced loneliness compared to 1 in 9 in high affluent families. So almost double the difference for the low income families. One of our other aims was to look at how and are school holiday experiences linked to mental well-being, and the answer was yes. But now I'm going to show you in what particular ways. When we looked at reports of how often children exercised or how often they spent time with friends, those who experienced more of these activities had a higher mental well-being, so a more positive mental well-being. When we looked at reports for going to bed hungry or feeling lonely, the more often young people experienced these feelings or experiences, the more likely they were to have lower mental well-being. When we looked at all of these experiences and we compared young people from low affluent families compared to high affluent families, we found that for those in the low affluent families, they were more likely to have both lower mental well-being, and they were also more likely to have negative experiences during the summer holidays. And kind of the final kind of piece to think about in our analyses was, what kind of relationship is there between a young person's affluence, a young person's experiences during the summer holidays, and a young person's mental well-being on return to school? And what we actually found was that a large proportion of this link between your affluence and your mental well-being on return to school was explained by your experiences during the summer holidays. So in fact, in our model, up to 65% of this relationship between affluence and mental well-being was actually explained by what happens during a summer holidays. So therein lies where we can have some impact and kind of narrow the inequalities. And just a final point on our findings. When we think about these 4 experiences during the summer holidays, loneliness was the experience shown to have the biggest impact upon a child or young person's mental well-being on return to school. So of all of these 4 experiences, really it's around the loneliness where actually we should be looking to perhaps invest our efforts. What do the findings mean for you and your school? So as you can see, a large proportion of young people are reporting one, some, all of these negative experiences during the summer holidays. And again, as a reminder, it is 6 weeks off school in the UK. Yeah. So there is a need to explore avenues for school holiday interventions to help reduce inequalities. As I mentioned, up to 65% of this impact on mental health could be prevented through efforts, perhaps in the summer holiday period. In terms of what your school can do, so a few suggestions here. So first of all, it's important to make families aware, so to make parents and young people actually aware of the study findings. So people are informed of actually how your experiences can impact upon your mental health in such a short period of time. Schools can also do a lot in terms of signposting, so during the term time and to inform the summer holidays. So where can young people and families turn to in the summer holidays so that they can stay connected? What resources are available for them? So here I've added the logo for Food and Fun. This is a summer holiday schools-based initiative, and actually the Welsh Government has recently funded an extra £2.7 million to scale up this intervention over the summer holidays in 2020. While it's primarily offered to primary schools, there is scope for it to be delivered in secondary schools, and it is currently running in a number of secondary schools throughout Wales. And that's a free summer holiday provision. And lastly, schools can take a collaborative approach. So just joining up with what's already going on in the community, what services are available out there to signpost families to, and almost building those links within term time so that we can enable families to go off and access what's available for them in those 6 weeks holiday. So I believe that's everything from me.
Oh, well,
so
perhaps I could, I don't know whether, I can't see that we've received any questions, so if I could perhaps just sort of as an observation really, we're encouraging schools very much to consider the sort of whole school approach to health and well-being. So you have a curriculum supported by the sort of ethos and environment, and I think we tend to think of that being the sort of during term times, during perhaps the day, the school day. But I know you've mentioned that there's stuff you can do before the young people go on holiday, like signposting and maybe showing an interest if schools are approached. But I mean, so really when we're thinking whole school approach, it is perhaps a bit broader maybe than some schools, and we've realised.
Yeah, most definitely. And whereas this piece of research is based around young people's mental health, obviously it's just as important for teachers themselves to have a break and for them to foster their own mental health.
Yes.
But in terms of joined up thinking, most definitely. So building collaborations with the community, being aware of existing resources out there, and then just building links within term to then help kind of nurture and create more of a holistic environment for families.
Yeah, so that sort of link to the family and community will give the school some sort of knowledge as to what's there, rather than sort of expecting them all to work through their 6 weeks holiday. I think it's just that breadth really of what we're talking about when we talk about a whole school approach, and that so the food and fun, which is part of the school holiday enrichment program, is it?
Yes. So that's currently a 12-day program, spread across the 6 weeks. And schools express an interest, and then the Food and Fun Club is based at the school, and whereby children are offered a free breakfast, a free lunch. There's also physical activities included, and there's nutrition sessions, and really it's looking at more of a holistic approach, also with a view to trying to narrow any educational inequalities.
Right. And actually some of those things, your findings about not doing physical activity, some of those things and the holiday hunger agenda will be met in that sort of holistic way.
Yes, so, very much so.
Yeah, so it's a sort of promising development, isn't it? So
it's a step.
Yeah, it's a step, and it's fantastic to have. I think it's a really concrete example of where the Joan data can really start to inform us as to what what sort of actions need really to be put in place. So I think a huge thank you. If Gillian has just won. So why? Oh, right. It's just disappeared. So maybe I could ask Matt just to read that question that Gillian has just asked.
Why do you think there was no difference by affluence for going to bed hungry?
Right. So I don't know if everybody heard that because he's a bit further away, but why do you think there was no difference in affluence
for going to bed
hungry?
That's a very good question. And off the top of my head, I think it was roughly 6 or 7% of young people from a low affluence reported going to bed hungry, compared to roughly 5% of the high affluence. Yes, there was no difference. So there are a number of potential reasons. One could be perhaps the crudeness in our measure. So simply asking a young person, how often do you go to bed hungry, whether they've had a full belly full of dinner, some of them still may well go to bed hungry. So definitely around the sensitivity of the question that we're asking. So a lot more research will need to go into that particular area. That's potentially one.
Yes, that would seem to. Seem to make sense. Well, so there's obviously, you feel that there's room for sort of further research in this area.
Yeah, most definitely, because we're also interested not only in the feeling of hunger, but also the quality of food. So we can't comment on the quality and the nutritional value of food that children are experiencing across levels of affluence. So a young person could still be going to bed full, but perhaps not having had a nutritious meal, for example.
Yeah. Well, thank you, Kelly. I mean, I know that if anybody wanted any further questions asked, and if you email me, then I can obviously forward those to Kelly. But thank you. That was it's a really interesting area to focus on. So I'm just going to use a bit of time now just to give you a bit of network news. It's too good an opportunity to miss. So as we say, the research briefs will be on our on the website, and as with other Joan research, this will be the research brief, which is a sort of easy to read briefing sheet, quick to sort of digest, with a sort of this is what it means for your school. That will be on our website, but also we will email it to you all straight after this website, and you can there look at the other 15 research briefs that we have on our website too. Just a sort of little look at the range of research that's going on as part of our network. So there's some that, if you're particularly interested in the mental and emotional health, there's certainly, we're looking at sort of supporting wellbeing in schools at the bottom, children in care, emotional health and wellbeing. But there's also ones on physical activity, sexual health and relationships, and smoking and e-cigarettes. And if you were able to join us for the previous webinar that we ran just before Christmas, we did a sort of joint one on gambling and adolescent dating and relationship violence. So if you weren't able to join us, those are now on the website, and the link will be included in the next newsletter we send out to schools. A new date for your diary. We did sort of put some dates together literally in September to say when we thought the webinars would be, and we had thought that we'd be running one on Wednesday, March the 18th, but in fact we've had to change that. So just to say that this is going to be run by 3 professors. So the collective now for professors, I'm not sure what it is, but we'll have 3 there. So Simon, who is the lead for our network, but Fran Rice and Stefan Collishaw, who work in Cardiff University, but on more the sort of genetic links to mental health. And they're going to look at how our Joan network can support a whole school and even a whole of Wales approach to promoting positive mental health. And it will include some guidance on using the mental wellbeing data in your student health and wellbeing reports that you'll be getting at Easter. If you were here, if you joined us for our summer event, you'll know that we introduced some new mental health measures, and we'll be feeding some of that back. So that's an opportunity for you to join us to find out a bit more about that. Just some other dates. We've got the summer events coming up, so if you haven't got those in your diary, you might like to put them in your diary. So we'll be running 3 as we have done before, and the venues have stayed the same because they were positively evaluated. So we hope that we'll see you at those. And then just a little plug. So I know last term was really busy with you all doing the student survey, and we did have more schools doing the student survey and more young people doing the student survey in 2019 in the autumn than we did the last time when Kelly's data is based on that. So that was really great news, but we're now just asking you, and it's just one school environment questionnaire for a school. It's in the spring term and it's with you now, and it looks at sort of school policies and practice around health and wellbeing, and it is electronic for the first time, and we'll be giving you 6 weeks. So we'll be asking for you to be basically, it's an electronic survey that goes straight back to Ipsos Mori, but all the instructions should be at your school. So if you haven't got those, then please just get in touch and we can send the details. And it will be either for a sort of health and wellbeing lead to complete, or a group of senior leaders relating to health and wellbeing. And I think you should find it as a sort of a good internal audit of health and wellbeing activity, which could go into your self-evaluation. And the data with the student survey, alongside the student survey data, is absolutely invaluable for school health research. And a lot of these webinars are based on the use of both of the data. So just get in touch if you've got any queries on that. And I just want to thank you for joining our webinar, as well as sending the research brief that we have for Kelly's research. We're also we've done a national briefing paper on young people looked after in Wales, findings from the 2017-18 data. That just has been up for a week or so on our website, but we will actually send a copy of that as well. So if you haven't caught up on that, you'll be able to read that. So thank you ever so much. Thanks for joining us, and we'll see you March the 25th. Thank you.